Good evening. As we all know, President Obama has been fighting for a national health care law for the greater part of his presidential terms. His premise, the Affordable Care Act, also known as Obamacare, seeks to provide affordable health care for all Americans by expanding how much insurance companies will pay by 60% and also ban the practice of denying coverage to people with pre-existing health problems. That sounds like a noble cause, but it will have a negative impact on young Americans. I have 3 points of analysis for this. The Affordable Care Act increases the cost of insurance for a specific group, mainly the age group between 18 and 35, young single Americans in good health standing. No smoking, no pre-existing health concerns. The Affordable Care Act unnecessarily increases the breadth of coverage, and the Affordable Care Act imposes penalties for non-compliance. For increasing premiums, according to a study done by the U.S. Government Accountability Office, the rates for a 30-year-old non-smoker will increase by an average of 260% across the nation. To look at more specific terms in the states, Sam Caponanti, an economic analyst who observed of the 51 states studied, all experienced health insurance rate increases, with 44 of those states experiencing triple-digit percentage increases. Increases in premiums for the lowest price coverage, pre-Affordable Care Act premiums average $62 monthly, while post-Affordable Care Act premiums average $187.08 monthly. What is causing these premiums to go up? Well, the backbone of the Affordable Care Act is the 60% rule, which is the minimum actuarial value of the insurance premium. And what this is how much your insurance company is willing to pay when you need to use your insurance. The Affordable Care Act wants to group plans into 4 categories: bronze, silver, gold, and platinum, each constituting 60, 70, 80, and 90% coverage. According to John R. Gabriel, an economics on the ROC board at the University of Chicago, more than half the plans currently available in the individual market would not meet the bronze tier actuarial value threshold, with 12% of the plans having an actuarial value between 35 and 49%. And why is that important? Well, for young Americans, they don't really want comprehensive coverage. They're young, they're healthy, they don't really need all the bells and whistles the Affordable Care Act would bring. So the 60% coverage is unnecessary for them. The 35 and the 40s will do perfectly fine. The age-man ratio will also increase. What this is it's a law in each of the 50 states that says it has a 5-to-1 ratio, meaning an older enrollee's premium cannot be more than 5 times that of a younger enrollee's. To compensate for the rising premiums, the Affordable Care Act has provisions to compress this ratio to 3-to-1. What that means is the 1, which is the young American, will have to subsidize the new ratio. So his premium will go up in order to compensate for the lower premium on the older individual. On to my second point, the Affordable Care Act unnecessarily increases the breadth of coverage. The essential health benefits, which will be covered by all insurance premiums, will be expanded to include seemingly unnecessary services to a young individual. Beginning in 2014, non-grandfathered health plans are required to cover essential health benefits fitting into 10 categories of coverage. The expansive categories require coverage of ambulatory services, behavioral health care, outpatient prescription drugs, maternity and newborn care, preventative and wellness services. This is comprehensive coverage, something that is not needed for a young individual. Federal and state operated exchanges can also charge insurance companies in order to sell their products. Most of these are going to be administration fees. So all the exchanges that are going to be set up during the Affordable Care Act will have to be subsidized by you. And according to Trustmark companies, a life insurance company, the monthly user fee based on the percent premium attributed to an insurer's exchange-based sales accounts for a 3.5% increase in your premium. You're paying 3.5% just to use the exchanges during what's going to be set up in the affordable health care. So, and lastly, why is this all important? Well, the Affordable Care Act imposes penalties for non-compliance for all Americans. Individual mandates will be forced upon anyone without insurance. Starting in 2014, the Affordable Care Act will impose a 1% fee on excess of the taxpayer's household income for the taxable year. That is your tax return. So anybody wondering what they're going to get for the tax return, take away 1% if you don't have health insurance. You're going to take it. And then after that, the fees will continue to rise to 2% in 2015 and 2.5% after 2015. In case of any calendar year after that, the applicable dollar amount shall be equal to $695 or higher, depending on your income level. Government subsidies will not provide relief. If you make lower than 275% poverty level, you'll get a subsidy for signing up for the Affordable Care Act. However, 275% below poverty level is $37,000 for a young individual. $37,000 in California is not a lot of money. And for you to be paying another 3 times the amount of health insurance is unacceptable. So the negative effects on the young unhinge the original premise of the Affordable Care Act. It should be affordable health care for all, not affordable health care for some. Thank you.
All right, James, the proposition's a little broad, but you do clearly identify it. There's a good layout of what the secondary claims are going to be. On each of those secondary claims, I thought you did a very good job explaining concepts. Sometimes we get factual data that's being presented, the 60% rule, the 5-to-1 down to the 3-to-1 ratio. I'm sure all of those things are true, but a source citation on them would be helpful. I did think that you did a good job citing estimates of the increased costs. You had a good source on that. Like I said, a lot of it is dependent upon the factual data that you're supplying, and I think that, for the most part, I don't doubt that anything that you've described is accurate. The inferences, though, I think you could use a little bit more expert testimony to help support the generalizations that you're drawing from those inferences. You got a couple of hypothetical examples that illustrate the point, like on what people need or how much they're going to be paying for their premiums in the future. I thought it was nicely presented. It's calm and deliberative. You're not really reading very much, so I think it comes across very effectively. Thank you.